everyone. I'm Casey De Jesus and I'm here to perform cranial nerve examination nursing 1. Cranial nerve assessment 1 to 12. So, first thing to do, provide privacy to the patient, perform hand hygiene, explain the procedure or what will be your doing. So, let's get started. So first, cranial nerve 1, the olfactor, the sense of smell. So what are you going to do is close your eyes and tell me what you smell for.
Vinegar.
Okay, so that cranial nerve is intact. And next, we have cranial nerve 2, optic nerve. We're gonna do 2 tests. First, confrontation visual field, used by peripheral vision. Second, visual acuity, assessed by Snellen chart. So, let's get started. In first test, my patient stand in front of me. So, Hannah, you're going to do, I want you to cover your right eye and left is mine. And I want you to look at my eye and not my finger. So, my finger point down, up, side and side. And I want you to tell me how many finger you see. So, let's start.
1, 2, 3, 4.
Okay, very good. So, we're going to do a visual acuity assessed by Snellen chart. And you're going to do, let your patient stand 20 feet in the chart. So, read the Snellen chart and cover your eye and left hand.
8, D, E, F, P, O, T, E, C. 8, D, E, F, P, O, T, E, C.
And no hand.
8, D, E, F, P, O, T, E, C.
Okay, so she can read 8, a 20/20 peripheral vision. Next, we're going to assess cranial nerve 3, oculomotor, cranial nerve 4, trochlear, cranial nerve 6, of the sense. So first we're gonna looking involuntary shaking of eyes called stagnus. So how we gonna do that? Hold your pen light and we're gonna hold that 12 inches away in the patient nose. So Hannah, don't move your head. I want you to look the pen light where the pen light going. Okay. Cranial nerve 4. We're gonna see how react pupils. So we're gonna dim the light a little bit and let your patient stare off of the distance object. And we're gonna use this pen light and the side to side so that we can see how pupil react if she restrict both sides the eye. So let's get started.
Okay, we're gonna see the side eye. In the other side eye. And we can see the pupil.
Next, we're going to check for our accommodation. So I want you to stare off to the distant object and don't move your head. And we're going to use this pen light and we're slowly move it inward to the nose. So follow this pen light, okay? Okay, very good. So we're done to eyes. We document that pupils are equal, round, react to light and accommodation. Cranial nerve 5. Trigeminal nerve. This is responsible so many things like mass occasion. And I want you to do Hannah. I want you to bite down for me. Okay? And I'm going to massage your jaw muscle. And I'm going to massage your temporal muscle. And open your mouth. Okay, very good. Next, cranial nerve 7. Facial nerve check. So, can you close your eyes tightly for me? Okay. Now, smile for me. Okay. Frown. Okay. And pump out your cheek so that cranial nerve is intact. We're gonna test cranial nerve 9, vestibulocochlear. So I want you to do, I will cover your ear in left ear and I whisper 2 words and tell me what I whispered for. So same as right side, so let's start.
Cat and dog. Baby honey. Baby honey.
Okay, very good. Next, cranial nerve 9, glossopharyngeal. So I want you to say ah while I enter this tongue dispressor.
Ah. Ah.
Okay, very good. Cranial nerve 10, vagus nerve. It is able to talk or able to swallow. So next, we're going to test cranial nerve 11, accessory nerve. So Hannah, you're going to do, I want you to move your head side by side. Up and down. And move your shoulder. Okay, very good. The last one is cranial nerve 12, hypoglossal nerve. So what are you going to do is stick up your tongue and move side by side. Okay, very good. So that's all. I hope you learned how to assess a cranial nerve 1 to 12. So goodbye.